Good morning, everyone. My name's Deb Lynch. I'm the mother of 6, including 2 sets of twins, and I have 9 grandchildren. My background is in the health industry. I was a phlebotomist for 20 years. I was also a pathology laboratory manager. I'm standing at the moment because we've been, as the president of the Medical Cannabis Users Association of Australia, I've been lobbying government in Queensland for law reform for cannabis patients for the last 5 years. Sadly, the majority of patients, 48% of the patients who are getting legal prescriptions cannot afford to pick those prescriptions up from the pharmacy. So they're having to turn to illicit supply to be able to treat their diseases, myself included, and the police resources are being wasted, arresting sick patients like myself. We've got I believe that the policing operating budget is $1 billion a year. 500 million of that is being spent chasing little old ladies like myself from being able to help themselves. The Queensland Government received a petition of over 14,000 signatures earlier this year. That wasn't even debated before Parliament. It was just sent on to the Health Minister and ignored. So the government, be it the present government or previous governments, have not been listening to the people for a long time, and we would like to change that. We want the people to have more interaction in the running of the state. I mean, government's one job is to run the state and to oversee the public services. We have 40,000 people on the waiting list for public housing. We have an enormous waiting list for health. And to be perfectly honest, all of these departments need to be investigated as far as they're running. We saw Jackie Trad and the education suggest that from an inquiry, that the public service issues need to be addressed, and I believe the same thing happens here. I had a tumour left in my kidney for 5 months, and I lost my kidney due to administrative oversight at Gold Coast Hospital. I'm done. All of these things need to be addressed, all of these things need to be overseen, and it's not happening with the present round of people we have in there, which is why I'm standing. Thank you.